Diana is a financial program manager specializing in financial help for multiple myeloma and AML patients. As a professional financial advisor and former caregiver of her husband who was diagnosed with multiple myeloma, Diana perfectly understands the financial issues facing cancer patients. And with that, we'll turn our time over to Diana.
Hello, everyone. Thanks for joining us on this Tuesday. I know we're a little bit later in the month than we normally are, but we had such a wonderful time at the summit. That's why it's later. If any coaches are out there that was not able to attend, please look to try to attend next year. There's so much information. You can talk to these doctors and these researchers and get the latest and greatest things that are going on, as well as what's going on around HealthTree. HealthTree is growing, and it's just so exciting as to where they're going. I want to talk a little bit financial updates. I just want to have people keep an eye out for things that are happening with Medicaid, Medicare. If you end up off of the Medicaid roll, please call in and sign up. It was because, things for the Inflation Reduction Act that Medicaid, you didn't have to sign up, but now you have to. Please go out there and reassign up for that if you have Medicaid and was dropped off of their rolls so that you can continue to get your care. I would like to now start into this webinar in areas that aren't talked about as frequently probably as they should, which means a lot of patients aren't getting access or not accessing some of the latest, greatest treatments that are available to them out there in for their blood cancer, not just myeloma, but for all the blood cancers out there. And I also want to let you know that this is my financial webinars and my articles are going to be more geared toward all blood cancer, not necessarily specifically myeloma, because a lot of these things, these financial issues affect everybody. So we're going to start going forward with this. And with that, I would like to go to the next slide. So we're going to talk about understanding the cost of your that you're responsible for clinical trials, second opinions and third opinions, and telehealth. So what I hope to accomplish in this is for you to understand how you can get coverage or question the coverage or declines in your treatment, whether it is for the clinical trials, the telehealth, or the second or third opinions, and to make sure that you can get access to those things and make sure that your service and treatment is covered. Next slide. So understanding the cost of clinical trials. This is one area that a lot of people are not sure of, and the things you need to do before signing on the dotted line. After you found a suitable clinical trial, there's a lot of things you need to be aware of before you sign on that dotted line. Determine where the trial is being done. Very important to find out if it's going to be covered. If it's out of network, some of the costs may not be covered by your insurance, and we'll just say what some of those costs will be. Additionally, you may have added costs such as transportation, food, and lodging, as well as maybe childcare. But there are resources that can help you cover those costs as well. Sometimes the clinical trials will help you with those costs. Next slide. Can we get the tiles out of the screen? Is that possible? So there are lab tests that are needed for the sake of a trial rather than your normal care. Cindy, are you there?
Yes,
Okay.
I think
They're out.
you got
Okay.
it. Okay.
Okay. So there are lab tests that are needed for the sake of the trial rather than the normal care that you would normally get whenever you go into the doctor's office. And they're generally covered by the trial sponsor. The trial sponsor is the one who does the outreach that you can talk to regarding the costs that you may be responsible for while you are participating in a trial. Travel costs and other expenses, you may be reimbursed for these costs to the sponsor, especially if it's one that's a little bit further away than your normal doctor. Ask them directly if they will reimburse these costs. You'd be surprised how much they will actually help you. Your copays and deductibles. If copays are part of your insurance plan, like most people have, you may need to continue to pay for them for your routine visits, like you normally go in for labs or routine visits with your current doctor. You will still continue to have those copays and deductibles. However, you may want to check with that trial sponsor, and they all vary, to see if they will help cover some of those costs. Next slide. Next slide. So your insurance must cover necessarily routine care costs and clinical trials. Routine is, like I said, you go into your doctor's office to check and see how your blood is doing, or you may have scans. Some of those things are generally routine care. The plan works exactly the same as when it covers routine care costs outside of a clinical trial. The trial must be approved, meaning to qualify, the trial must have written a protocol already approved by the Institutional Review Board. These are trials. They know they're going to trial. They've already looked at what the trial is supposed to do or what they're trying to accomplish on the trial. And those things have to be approved before you can actually sign up for one. Your care providers and hospitals must be in network. If you don't have out-of-network coverage, check your insurance coverage, please. The same coverage applies as if you were under your regular plan. So if your insurance says we will not cover trials outside of your network, or we don't do regular routine outside of your network, then you may have problems with the clinical trials outside your network. But check with your plan sponsor and also see if you can get a different approval for that particular trial. For some insurance plans, a trial must be for a life-threatening condition. This can be interpreted differently by insurance plans, so be very careful and make sure your doctor has supplied the correct and most comprehensive reasons as to why this trial is in your best interest. So be sure to check with your insurance plan, the plan sponsor, and then work with your doctor to make sure they're going to get covered with that for that trial. Next slide. So there are grandfathered in insurance plans that may not cover participation. These are plans that were insurance plans before the effect of the Affordable Care Act. It was in March 2010. So anything prior to that, they may be grandfathered in. They are not required to cover routine patient care costs in clinical trials, unlike your other plans that were no longer part of the grandfathered insurance plans. If a grandfather plan changes in some certain ways, such as no longer considered such a plan, then it must follow the federal rule as if they are now part of the approval for the Affordable Care Act, and you can get participation or covered for that participation in trial. Check with your health plan if you're covered under an employer. Some of these may be grandfathered plans, and they may make a difference in what the insurer will pay and what you will be required to pay. They vary between plans again. They can consequently affect your ability to participate in the trial due to associated out-of-pocket costs. And if there is a question, again, if there's a question and it's a life-threatening illness that you're trying to participate in a clinical trial, then make sure your doctor files appeals. You can file appeals and see whether you can get covered for participating in a trial. Next slide. Paid clinical trials. These are a little bit different from the other ones that are approved. These are particularly phase 1 trials. This is when very few, if any, human participants participated in the trial. They are less understood than trials in phase 2 or phase 3. They have their pros and their cons, just like any trial. They typically involve more risk than later stage trial, may not yet have been tested on humans, or may have been tested on only a very few volunteers. If you decide to participate in this type of trial, all associated split risk and cost will be explained to you by that person who's handling that trial. Later phase trials, sometimes phase 2 and specifically phase, I can't speak today, phase 3, offer reimbursement for your trial, or more often for travel or childcare. Very important for those who are diagnosed younger and they still have children. These things are not always advertised, so it's always wise to ask the study team, whether it's a phase 1, phase 2, phase 3 trial, always ask the study team or the trial sponsor to find out exactly what's covered. If they don't say anything about childcare, if they don't say anything about travel, ask them. Better to ask and for them to say no than not to know, than to find out later on that there's things that could have been covered. Next slide. So some things to submit to your insurance provider when you're seeking out understanding your out-of-pocket costs for your trial and things that you can fight in behalf of getting paid for. Ask the trial study team or the plan sponsor if others have had problems with insurance coverage. you may have the same insurance that else may have, and they're already fighting that battle with someone else. And you can actually come into play with a lot of those things and share information. Here's some things you can collect to submit to your insurance carrier that will help demonstrate why this clinical trial is important for you. Medical journal articles are very important that are from prior studies that explain the potential benefit of the treatment, especially if you're in a life-threatening sort of situation. A letter from your doctor that explains the trial or why the trial is medically necessary for you. That's very important. This is also very important when you're fighting any kind of insurance appeal, when you're going through any kind of insurance appeal. A letter from outside supporters of the trial, such as patient advocacy groups, and there are quite a few out there. You can Google advocacy groups and Google or talk to a plan sponsor about advocacy groups that may be supporting these trials. The next slide. So now that we're going on to second or third opinions, and there is a lot of misunderstanding as to what insurance will and won't pay for and what kind of options you may have to get those opinions paid for. So many patients aren't aware of how this works or know how to overcome insurance objections and how the second opinion should work. And I should say second or third opinion. So we're going to lay out the information you need to understand second and or third opinions and how to best get them covered. And the most important thing throughout anything that I talk about with getting things covered with your healthcare is to know your insurance. That is your foundation for your treatment plan. So what is a second opinion and how does insurance say it need to be conducted? What are the insurance parameters? Let's go through those. So a second opinion is when your current doctor has recommended surgery or other major diagnostic procedures or treatment. The second opinion is to give you a fresh perspective and additional options so you can make a more informed decision. So what you do is your doctor may refer you to a second opinion, or you may find a doctor yourself for the second opinion, and it may be in the same hospital, or it may be in a completely different hospital. And so you need to call your insurance company and make sure that the doctor you're going to is in network and we cover it, and that your insurance may even cover out-of-network doctors. If you have traditional Medicare, which is Part B, it will pick up 80% of the cost, while the remaining 20% is covered by you or a supplemental plan. If you don't have a supplemental plan, such as a Medicare Advantage or Medigap plan, then that 20% is going to be your responsibility. Keep in mind that you do not need a referral from your doctor to get a second opinion. Next slide. So what are third opinions? And in fact, my husband actually got a third opinion. A third opinion is usually sought if the first and second opinions are so different from one another. So how do you choose between a first and a second opinion and their advice for recommendation for treatment is so completely different? A third opinion can be a tiebreaker. Insurance will often pay for a third opinion. If they don't, again, you can appeal this saying, I got these two opinions and I don't know what to do, and ask them to see if they can actually cover for a third opinion. Again, get confirmation from your insurance provider before getting that third opinion to make sure that third opinion is going to be covered. You have a lot of options. A lot of people stop at the first no. And I'll tell you, when you do appeals, generally a majority of people who go through insurance companies and get appeals for additional treatment, for getting coverage, a lot of times those are actually approved. So don't stop at your first or even second no. Next slide. So if you're covered under Medicare Advantage, you can also get covered for second opinions. However, you need to follow certain steps to get these expenses covered. Very important. Make sure you understand the procedures and the steps in order to get things covered. You may need to get a referral from your doctor, depending on what kind of insurance you have. Medicare Advantage will possibly require you to get a referral from your doctor, especially if you're under an HMO plan. You may have to consult with a doctor in their designated network. And what does this mean? If you go to a cancer center and your specialist or your doctor has multiple doctors in that office or in that practice, your insurance may sometimes require you go to another doctor within that same practice. Oftentimes, those doctors follow the same procedures, protocol for how they monitor or recommend treatment. So that may not be a real good second opinion because they're following the same procedures. So I would suggest you look for a doctor outside of that practice who's going to do the same medical medical protocol that you need to make sure you get a good second opinion. And I'm going to talk about that a little bit later in this webinar. So you need to familiarize yourself with your insurance Medicare Advantage plan and their specific guidelines, including in-network, out-of-network, and what they require for you to get a second or third opinion. Next slide. So why is it more prudent to seek a second opinion from an unaffiliated practice? That's what I was talking about, a practice where the doctors are not working with one another. Hospitals and practices can be uniform when it comes to treatment. Recommendations of some doctors from the same group are likely to offer the exact same advice. So if you're getting the exact same advice from these two doctors, that may be because that's what they are required or that's their protocol for their treatment. So you can ask your doctor for a referral for an unaffiliated group or search for one on your own. If you have original Medicare, you can go through Medicare's Care Compare tool at medicare.gov/care-compare or call 1-800-633-4227. They can help you find an unaffiliated group with your type of cancer to see if you can get and look through your insurance to make sure that you can get a second opinion covered. Medicare Advantage enrollees can search for a second opinion by calling your plan's website to obtain a list of candidates. So there's several ways you can find a really good second unaffiliated practice that can give you a second or possibly a third opinion. Next slide. So make sure that the doctor you're going to has your records before your appointment. So if you're going to get a second or third opinion, make sure all your records have been sent to them before you show up for your second opinion. This will help to eliminate tests being performed that have already been completed. If the second doctor wants to perform additional tests, they will be covered. And I'll tell you, give you an example of what my husband went through. He was being treated in Louisville. We do not have specialists, Medicare, multiple myeloma specialists in Kentucky. We chose to go to Chicago to Northwestern. After speaking to Northwestern, they requested that the doctor in Louisville go in and do a bone marrow biopsy, which he had done, and send their labs that had been formed earlier the week. We did that, but they also told us that they may perform the same protocol when he got to Chicago. The following week, we went to Chicago. They performed all the bone scans, all the MRIs, blood work all over again, as well as another second bone marrow biopsy, so they can have their own information, so they can make a good second opinion based on what they were able to collect. And that gave my husband a better understanding of where he was going to get treatment, what kind of treatment options were available to him, and make sure the insurance was going to approve it. Next slide. So going through first, second, and third opinions. Now we're going to go through telehealth. And I want to tell you there's a lot of changes and a lot of questions have been going on about telehealth. Telehealth became very, very popular during COVID when people couldn't go into the offices. The doctors were able to call them at home and go through how they're feeling, just almost like a regular follow-up visit, and maybe only go to a lab for lab, but the regular appointments were done via the telehealth. Now, because COVID is officially, the pandemic is over, a lot of people are now requiring you to go into the doctor's offices. And insurance companies are pushing back onto whether they want you to go into the offices or be able to maintain the telehealth appointments. And the telehealth has been very, very beneficial to a lot of people. You can connect to your healthcare provider via a smartphone, laptop, or computer. If you do not have one, that became the issue for a lot of people who are in rural areas that do not have really good link ups or wireless links, or they didn't have a computer at all, then they didn't have choices. They had to go into the office. Because the cost of the telehealth appointments or visits can vary, it's a very good idea to get a cost ahead of time from your insurance company to find out what they are going to cover or not cover so that you can avoid any surprise bills. The cost of a telehealth visit will vary again depending on your health insurance coverage, your health condition, and the healthcare provider. And we'll tell you why it may differ between healthcare providers, even if they're in the same, let's say, building where you might go and get a specialist or your oncologist or your primary care. We'll tell you why that telehealth visit may be more expensive depending on who you go to. Next slide. So you can get telehealth visits from almost any healthcare provider. However, The type of provider you choose, like I said earlier, can affect the fees you pay. For instance, the telehealth visit with a primary care physician may have a different cost structure compared to a specialist, and you can understand and probably figure out why that is the case. Next slide. So specific service providers, the complexity of your condition and service will play a really important role in determining the total cost for a telehealth visit. For instance, if you go to your general practitioner, the advice that we get is maybe less expensive than a telehealth visit with a cancer specialist because you're dealing with a specialist and they have to go over so much more. Next slide. So some insurance plans may cover a part or the entire cost of your telehealth visits, while other plans, health insurance plans, may need you to pay deductibles, copays, or coinsurance, just as if you're going into the doctor's office for a regular visit. Again, review the details of your plan prior to getting a telehealth visit. What you'll see as a general line or general familiar thing throughout everything that I talk about, no matter what we're talking about with health insurance, no matter what my webinars, insurance, knowing your insurance, making changes when necessary, understanding what your anticipated treatment plan is going to be is very important for you so that you'll know what best insurance you can get into if you have the option to change mid-year or during open enrollment periods so that you can get most of your health care covered based on what your needs are. That's going to be a common theme throughout everything that I talk about. Next slide. So commercial insurance versus your federal insurance like Medicaid, Medicare plans, or VA plans. Many states have broadened the coverage for telehealth services, but that says many, that's not all. To find out what is available in your state, go to Policy Finder tool at cchpca.org. Although most plans cover at least some form of telehealth services, it is smart to contact your insurance provider to verify prior to your appointment. Again, verify with your insurance prior to doing anything. Verify what your treatment's going to be, what your medicines, what all the options, if you're going to be getting maybe a stem cell transplant or maybe looking at CAR-T next year, find out what your current insurance has. And if you have the option to change that insurance coverage mid-year or open enrollment, make sure that you do that so you can get as much covered as possible. Next slide. So Medicaid is expanded in most states and it's continuing to be expanded in other states. Medicaid reimbursements, however, still vary from state to state. Every Medicaid plans are determined by what the states say they're going to do. So make sure that you check your Medicaid plan to find out what you're going to be covered, especially if you go out of state for coverage. It may differ for the treatment and the cost if you're getting treatment in state. The Center for Connected Health Policy has information on permanent state telehealth laws, and you can find them at this link. Very important. If for anybody who's signed up for this webinar, you'll get access to all this information. Next slide. So Medicare and telehealth costs. Until December 2024, Medicare will pay for office, hospital, and other visits with a wide range of providers such as your doctors, nurse practitioners, licensed social workers. Now, I said until December 2024. There will be changes after the end of this year. You may still be required to cover copays like regular doctor's visits. You will also still have to pay your Part B deductible. Additionally, you may also still need to have a prior approval for the telehealth visit based on your insurance. Contact your insurance provider. Again, that common theme. Know what your insurance covers. Next slide. So how can you save on telehealth visits? Just like you can save on prescriptions, you can save on telehealth visits. Refer to GoodRx Telehealth Marketplace. I know you're probably familiar with the GoodRx for your prescriptions, but they have a telehealth marketplace. You can go there to compare prices for common services across popular telemedicine apps. So use this link, www.goodrx.com. There is a lot of resources available to patients if they're willing to take the time to go out and search for them. Next slide. So what are the costs or the average cost for telehealth visits? The average cost, and again, average cost of a telehealth visit without insurance can run between $40 and $90. So that's the average. You can save money on telehealth visits by checking your insurance coverage and asking about discounts, including GoodRx telehealth, global telehealth. If telehealth has been a good tool for visits, you need to keep abreast of the changes that may affect your care in 2025. There are a lot of insurance companies, a lot of providers are having some debate among the good use of funds for telehealth visits. And that's going to be an ongoing debate, I think, going forward. So keep up with what your insurance company is doing. Next slide. So through December 2024, patients can get telehealth visits wherever they're located, whether you're in, what state or city or local. You don't have to be at an originating site, which means if you get a telehealth visit through a different doctor's office where you went to for, let's see, if you're going to see your dentist or your vision care provider, you will still be covered the same. An originating site is a location where a patient gets physician or practitioner medical services through telehealth. Remember, it could be your social worker, your general practitioner, your doctor, generally within a geographic location. However, after December 24, for non-behavioral or mental health, that means for regular healthcare, there may be original site requirements and geographic location restrictions. For behavioral or mental health issues, all patients can continue to get telehealth wherever they're located with no originating site requirements or geographic location requirements. So what will change is your regular health visits, which is really, really important to everyone. Next slide. So I want to kind of summarize. I know there's a lot involved in that. And what I want everybody to understand is no matter what kind of treatment you're seeking or opinions or recommendations you're seeking, make sure your insurance is going to cover it. Remember, in October, there's going to be the open enrollment again period for Medicare. So keep an eye out as to what's going on with that. Find out what your treatment is. Not a good time now to talk to the doctor about if you were to relapse, what they suggest your next treatment's going to be. Here's a good tool. I'm going to say this. I hope I can remember to say this on everyone. Cure Hub can give you a wealth of information. I would encourage everyone to talk to people they know who have blood cancers to sign up for Cure Hub, HealthTree and code Cure Hub, because they can tell you about the latest clinical trials, and they can actually, with all your information in there, can suggest the clinical trials that you may be eligible for based on your illness and your type of treatment is going to be needed and what you've already gone through. They can also help you find we can also help you find specialists in clinical trials. There's a lot of information on Cure Hub, and I would encourage everyone to sign up for it because it's going to give you, it's a time saver for you. So you don't have to do a lot of this legwork yourself, and it can weed out all the things that won't apply to you. So I am going to wrap up that webinar, and we're going to talk about our next meeting. It's going to be on September 10th, a little earlier in the month. Again, we're only doing the webinars, the financial webinars every other month. Big thing is the changes for Medicare. I would encourage everybody to go into this. There's a lot of changes coming for Medicare. A lot of things are going to benefit you, and it'll give you time to understand what's going on prior to the open enrollment in October. Thanks everyone for signing in and participating in this meeting. And I would be glad to take any questions you may have.
All right, thank you so much, Diana. We've got a couple of questions that came in through the Q&A. First one says, for several years, we were able to get a tier exception for my husband's pain management drug. This year, the Part D insurer dropped it from the formulary. We got a formulary exception, but when I requested a tier exception, they said that that was not possible since we'd gotten a formulary exception. Is that true?
And again, these are some of the issues you have depending on what kind of insurance you have. That could be, but if it's something that's medically necessary, again, if that kind of treatment is medically necessary for you, you can really reach out and have a peer-to-peer review with the doctors from your doctor's office, peer-to-peer review for your insurance provider, and see if there could be another exception to making sure that you are covered. Again, look at all the different ways that you can go through your insurance company for them to look at your treatment and prescriptions, and then look at other resources available you get to get those prescription covered. GoodRx, a lot of times people don't think these GoodRx or Needy Meds cards that help with prescriptions can give you so much more coverage sometimes than your insurance company will. And what you need to do is get these, you get multiple cards, get these cards, they're free to you, give them to your drug company or your whoever you get your prescriptions filled, and have them run that prior to running your insurance, and they'll tell you the difference in cost. And sometimes it could be significant, especially between like between CVS and Walgreens, or even Kroger that has, or some of your food stores may have pharmacies within them. It could vary depending on it within the city or within a local area. So you can check those cards prior to using your insurance. But again, ask for a um, medically necessary letter from your doctor that help go to your insurance company to see if you can get those things changed or met, those costs met.
Perfect. Thank you so much. Our next question says, I am very happy with my current multiple myeloma physician team. We've got a managing doc and a treatment doc at sorry, Cancer Center in Philadelphia. However, I'm thinking about getting a second opinion from a managing physician at another practice. Will Medicare cover the cost of that second opinion?
Generally, yes, they will. If I'm going to call out a particular insurance company, and it's not that way with all of them. Kaiser is in the West is a little bit more strict on how you get second opinions. That's the only one I know that has where you may be seeing another doctor in the same practice. But generally, if you are in a different plan like United Healthcare, Humana, some of those plans, there generally is no problem getting a second opinion. Again, call your insurance company. It's a very easy call. Will you do a second? And say, will you also do a third opinion if the first two opinions, first and second opinions or recommendation are so different from one another? Generally, there's no pushback. In fact, a lot of insurance companies would like for you to get a second opinion to make sure you're not going to have a problem down the road or more costs to them.
Perfect. Those are all the questions we have in the chat so far, so I'm going to just give it a few more minutes and ask a couple of questions as well. As a reminder, you can ask your questions in the Q&A, which is down at the bottom of your screen. If you're on a mobile device, touch the three dots in the upper right corner and look for the Q&A there. But while we wait, I was just looking through the discussions that we had regarding clinical trials. This was an eye-opener for me. I didn't realize that there were some things within clinical trials that wouldn't just be covered by the clinical trial itself. And I believe you touched on some of this, but are there any specific things that you all know of that may not be covered by insurance and the clinical trial?
So, and it can vary again between clinical trials. I would suggest you call the clinical trial sponsor. There are things like the normal routine tests you would normally get are generally not covered. Some trials will do it. They may not cover all the travel costs, which would mean not just your car or plane costs. They may not cover childcare. Some places will because they really need people in a clinical trial, and they maybe have a hard time getting enough people to sign up. But I would always, before you say you're going to sign up for a trial, find out exactly what they will and will not cover, and find out what your insurance will or will not cover. It's really, really important, especially if you're going out of network. That is where your costs can really, really add up. So I would check with your insurance company and the trial sponsor, and they can send you out a sheet, information about what you can do, and they can refer you to like American Cancer Society might be able to help you with some of the costs for lodging or travel. So there's a lot of things that are available to you. I will tell you, I spoke to a lot of people in person at the HealthTree Summit this past week who have gone through clinical trials, and I'm telling you, I got goosebumps. I mean, I think it's not only are these people putting themselves out there to get treatment, but they're also providing great treatment for people who have cancers and new options. And it's a mind-boggling. When my husband had myeloma, he passed in November 2013. There were just enough more drugs coming online, and it amazes me how much has been done, how the needle has moved so much further ahead now with the treatments and that they have available now. And it's because there are people who are willing to participate in clinical trials. And a lot of these people are doing so much better as a result of participating. It's mind-boggling. I'm so inspired by these people who've participated in these clinical trials because that's how we get new medications. That's how we get new treatments, and it's awesome. It's so awesome. Again, if you go into Cure Hub and get your information in there, a lot is can be very easy if you have Cerner or Epic or one of those other um, um, programs to get your information in. It'll spew out a lot of information that you can take with you not have to do all this legwork. It's very, very important. Very important. I can't talk enough about it, about how important the Cure Hub is and clinical trials and how it's giving you the medications you're taking now that's helping meet your needs.
Absolutely. Absolutely. Thank you. We have another question. It says, my husband's doctor states that he should have Boost 3 times per day since his appetite has decreased. Will Medicare cover it? Right now, they're paying for it out of pocket.
If it's something that's considered medically necessary and the doctor says your Boost, my husband would do the same thing. A lot of times you can get those things covered. So talk to your oncology navigator at your practice where your doctor is. They will tell you where you can get these supplemental things paid for. Yes, there is
Okay.
coverage out there for some of those supplemental needs. Yes.
Excellent. Next question just says, what about foundations? I'm hoping that that rings a bell for you.
So if you're talking about nonprofit foundations paying for the cost of clinical trials, foundations will help you cover your regular medications that is on your treatment plan for your doctor. Now, anything outside of that, they may or may not cover, probably not because they're waiting for the sponsored trial to cover those things. Um, if you need it, like Leukemia Lymphoma Society has travel grants. You may be able to use a travel grant to get back and forth. But if you look at our resources page, a financial resources page, there's a lot of options out there for travel and for lodging and for food that could possibly cover you and partially cover someone who is traveling with you. There's a lot of options out there. No, insurance won't pay for all of those things because you have a sponsor that's outside of their normal treatment. Clinical trials are outside your normal treatment.
perfect. Yeah. All right. I know what you mentioned, of course, with second and third opinions, it's often tricky to make sure that you're getting an unbiased second opinion. You're getting a doctor who's outside of the same group that maybe um, always seems to treat the same way. Um, and you did mention we've got a couple of resources. We'll make sure that we link that to in the thank you email, Medicare.gov, Care Compare, and that 1-800 number. When you're going for a second opinion, I guess, what types of questions did you maybe come up with to make sure that you were getting an unbiased second opinion? Were there,
Okay.
yeah,
Well, if you're searching for your own second opinion, some of the things you can ask of the doctor that you're want to go see is what, first of all, what kind of tests are they going to need? Are they going to need to require to redo tests? Are they going to be able to take all the information you have from your current doctor? A lot of times for them to get their own current protocol, to go by their protocol, they will require duplicate tests. If they request it, that will be covered. I would ask if it's a network or not network from your current doctor to make sure that's going to be covered. I would ask if the doctor who is, and a lot of times you can talk to someone prior to that, maybe the oncologist nurse who's working with that doctor, to find out what the protocol is, how they normally would do it, how soon in advance you need to get the records over to them. If they need to cover tests, what tests those will be, how long you need to be there. When my husband was getting a second opinion, he was out of town for 4 days. They wanted him to stay longer in case they needed to repeat a test, but he was so tired and worn out. He was actually on the road when we got the update that they didn't need to do any more tests. But check with your doctor's nurse, oncology nurse, and with the nurse, the doctor that you're seeking the second opinion from, and they'll tell you if they're not in network with the same doctor, same practice, they will probably ask for their own protocol, and so that will be I would say a true second opinion.
Okay, perfect. And I like how you talked through asking about which tests would be necessary, and making sure that those will be covered. So thank you so much. It looks like, oh, we've got maybe one in the chat. It says LLS grant for myeloma is fully funded. Are there any other copay programs available to help with copays?
Interesting. LLS grants opened several days ago, 5 or 6 days ago. Yes, they open sometimes and close really quickly. As far as I know, they were still open. I have not yet checked it today. And again, it may be closed. There are other grants. If you go, there's HealthWell that's still open for Medicare access. If you have Medicare and it's $12,000, you can sign up for that one for copays and deductibles. There are a lot of them have closed, and they're changing a lot how much they actually offer out to people. HealthWell is still at 12. But they're coming down to maybe 5,000, which LLS copay deductible premium reimbursement is 5,000 versus where it used to be 12 or 13. And that's because they want to have more people have access to their grants. And because, the Part D prescription plan, your out of pocket has been reduced significantly. So there are some that are still out there. If you check our website for the financial resources through for the nonprofits, you can check with those. And a lot of times I know they also are not giving you follow-up as to when they may be opening or putting you on a waiting list. That has changed as well because of so much need is out there, which means there's a little bit, the onus is on you to do a little bit more work. But again, check those things and keep it in your thing to check every couple days or every week. And it'll change throughout the year. Whenever they have more money available for funding grants, they will let you know, or they'll put that information on their websites.
Perfect. And it has a request just to please repeat the site that you just mentioned.
Which site did I mention? We're talking about LLS.org, or we're talking about healthwell.org, healthwellfoundation.org, and that's the one that still has the grants available for $12,000 for Medicare
Perfect.
access. If you have Medicare.
Perfect. And we'll link that as well in the thank you letter. So okay, perfect. And they agreed it was HealthWell. Thank you. And I think with that, we've got all the questions for today. And I just want to say I appreciate you, Diahanna, and thank you for your patience with everyone today. I know we had some technical difficulties with the calendar invite that was sent out. So we're grateful that all of you were able to make it. And for those who weren't, we will be emailing out a recording of this presentation today. So again, thank you so much, Diahanna. I am just blown away talking to you at the Coaches Summit, and then also just listening to the things you have to say. You've got a wealth of knowledge, and we're very fortunate to have you available to us. So thank you.
Thank you.
Thanks. So close out. Remember, as you leave the session today, we would really appreciate you taking 2 to 3 minutes to fill out a brief survey about your experience during today's event. Our next financial education for myeloma meeting will be on September 10th, and will be a time to review upcoming known changes for Medicare. Our other upcoming events, we've got a really busy week ahead. Tomorrow, Wednesday, July 15th, we'll have the pleasure of doing some chair yoga with Jeff Abram. So if you haven't had a chance to sign up for that yet, go ahead and do that if you're available. I think it's going to be a great event. Then Thursday, our amyloidosis group will have the opportunity to hear from 3 members of the community about what is working for them. Next Monday, our PCL group will hear all about the efficacy of CAR-T in high-risk patients and strategies to improve outcomes. And then Thursday, August 15th, our MGUS and smoldering myeloma group will meet to talk about understanding MGUS, its progression risks, and more. The link to sign up for any of those events and even more events I've mentioned today is found at the bottom of the slide and will be sent out in the follow-up email within 48 hours of the event completion. Again, I would like to thank our sponsors, Adaptive, AbbVie, Genentech, Johnson & Johnson, Pfizer, Regeneron, and Sanofi. And thank you again for helping us build a strong myeloma community. I appreciate you and hope you have a great rest of your day.